we've made it. The last chapter of Dr. Landreth's book, Play Therapy, The Art of the Relationship, Chapter 17, Filial Therapy, the Child-Parent Relationship Training. Dr. Landreth actually has a training for this, and this is kind of an overview. If you are interested in this particular work, he does have this training for sale, I know, on Amazon as well as some other places. Many parents occupy time and space with their children without knowing or understanding them, without having times for emotional sharing with their parents while their parents respond in facilitative ways so that a relationship can develop. Some parents are not acquainted with their children in a way I have been with them. Parental efficacy, how parents feel about themselves, their adequacy, their insight, self-blame, their self-doubts of their ability to parent. The extent and pattern of parental involvement, whether it is rigid, hands-off, authoritarian, cold, smothering, whether it's demonstrative, warm, accepting, nurturing. All of these things are important to assess. There's a historical development of filial play therapy. 1909, Sigmund Freud worked with little Hans, a relationship between a child, a mother, and a father. He conducted a semi-sense of work with special sessions at home that is a little bit different than filial play therapy in that Freud mostly worked just with the father, but expected some of these things to occur outside of session at home and then to be reported back to him in session. Filial therapy originally was conceptualized by Bernard Gurney in 1964 as a structured treatment program for children with emotional problems. The term between parent and child, filial therapy, was coined. Play is a primary way children express themselves and work through issues. It is typically used with children 2 to 10. It can be adapted for older children and teenagers. It's typically coupled with a required parent-child play session and supervision in a supportive atmosphere, providing dynamic processes to set it apart from other kinds of parent training programs. The process is defined as a unique approach used by professionals trained in play therapy to train parents to be therapeutic agents with their own children through a format of therapeutic didactic instruction, demonstration play sessions, required at-home laboratory play sessions, supervision in a supportive atmosphere, taught basic child-centered play therapy principles and skills, including reflective listening, recognizing, responding to children's feelings, therapeutic limit setting, building children's self-esteem, structuring required weekly play sessions with their children using a special kit of selected toys so that parents can learn to create a non-judgmental, understanding, accepting environment that enhances the parent-child relationship, facilitating personal growth and change for both child and parent. The objectives are to strengthen and enhance the parent-child relationship by helping parents to understand and accept their children, develop sensitivity to their children's feelings, learn how to encourage self-direction, self-responsibility, self-reliance in their children, change their perception of their children, learn play therapy-centered theories and principles and skills through didactic instruction, demonstration play sessions with children, videotapes, role-playing, supervision of parents' play sessions. Parent sensitivity to their children is enhanced, and all of these other things where the child can feel safe enough to explore parts of themselves as people and other ways of relating to their families. This is typically done with families that are very problematic, a lot of times that have been mandated to care. Glover in 2001 said it's exactly this accepting, respectful relationship that makes child-centered play therapy an ideal intervention for children who have a different culture than the therapist. It's a new creative dynamic of empathic responding by parents to become a creative process in which change occurs within the parent and child and between the parent and the child. Allows the child through the medium of play to communicate thoughts, needs, and feelings to the parents. These are the objectives: to facilitate the child's development of positive self-esteem and confidence, help the child develop an internal locus of control, more self-directing, self-responsible, effective problem-solving skills, help the child change negative perceptions of his parents, see his parents as friends and allies, to reduce or eliminate problematic self-defeating behaviors. And they're expected to demonstrate skills they've been taught only during the limited time of once a week 30-minute play sessions. So, seems like a lot. Selecting the parents that are appropriate. There has to be parents that are not going to go home and take a very punitive approach or a rigid withdrawing approach toward their child after the session. Many parents don't know how to respond adequately in appropriate, emotionally nurturing ways to reactions and behaviors, like night fears and wanting to come and get into bed in the middle of the night, or bedwetting, or nightmares. They have a tendency to stop the behavior than to try to understand the child. Filial therapy is appropriate for most children 2 through 10, not just emotionally or behaviorally adjusted or maladjusted children. Some parents who are expecting their first child will sign up for filial play therapy, get an early start on knowing how to interact with their child positively. 5 weeks of twice-a-week play sessions at home is a 10-session model of filial play therapy developed by Dr. Landreth. Can also be done in a group format and training as needed. The structure and content of the session typically is 6 to 8 parents and a therapist in a circle engaged in discussion. It's not lecture-based. It does have homework assignments to maintain involvement between sessions, and the sessions are presented in session 1 where the parents introducing themselves, describing their child in detail. The parents work with only one child during training. So if they have other children, they would have to go back through this with each child because there's a special time of play for each child per week. Goals and objectives are explained, emphasizing the use of play by children to communicate experiences, reactions, and feelings, and to develop sensitivity and empathy for the parent, with it all being videotaped, and having homework assignments to identify emotions of anger, happiness, sadness, and fear of the child in the coming week. Session 2, the homework assignments are reviewed. The child is free to determine how they will use that time, with the parents participating, verbally tracking, empathizing, attempting to understand the child's thoughts and feelings, and observing the child's play actions, and then communicate that understanding by verbalizing the feelings experienced by the child with appropriate limit setting. Session 3, the homework is discussed, the parents report, the videotapes are reviewed, and parents are given a copy of some do's and don'ts. Don't criticize behavior, don't praise the child, don't ask leading questions or allow interruptions, don't offer information or teach, don't preach, don't initiate new activities, don't be passive or quiet. Set the stage, display the toys, say, this is our special playtime, and you can do many things that you would like to do. Let the child lead, track the play, reflect the feelings, set firm and consistent limits, salute the child's power and encourage effort, join in as a follower, not a leader, be verbally active. And trying not to exceed time limits by more than 2 or 3 minutes, with giving the child a 5-minute warning when the session is going to end. Session 4, reports and videotapes and homework assignments are brought in to be reviewed. And we learn to find responses and behaviors to support the ACT model of limit setting and choice giving in Chapter 11. The therapist demonstrates through role play every single skill that is made, and parents learn how to proactively and positively set limits. Sessions 5 through 9 is we have a video on the classroom called Choices, Cookies, and Kids. Same general format, processing the parents' feelings, homework, videotapes, the sessions as they go. Session 10 is a termination, a sharing, an encouragement of accepting and supporting their own contributions to their children's lives and to positive change. The research and analysis for this on page 388, 389, Ray, Bratton, Ryan, and Jones of 2001 conducted a meta-analysis of the effectiveness. They showed that Parent-child interaction is much improved, significantly improved, significant reduction in symptomology and stuttering, helping children that have learning disabilities, helping children that are having behavioral adjustments. Dr. Landreth's 10-week filial therapy model, again, is for sale and can be condensed into a 5-week session if need be, by combining some of the sessions. So that takes us to the end of this chapter as well as this book. I hope this has been very helpful for you as you are working through this. We're also going to go through the Cotman book and the Carmichael book within this class. So work on your assignments, let me know how it goes, and thank you for participating.